All right, gang. Well, I see that we have a good group on, so I think we should go ahead and get started so that we can respect your time, hopefully get you as much information as we can in this hour, and also leave some time for your questions. I'm Alex Huffman. I have the pleasure of presenting today's topic on reclaiming intimacy after cancer. This is geared toward sexual wellness for women. I'm really looking forward to covering this topic today. Just a few notes, and if you've been with us before, you know these, but we are recording this so that you can get a copy. That will come to your email next week, so you'll get a copy of the slides and the video recording. We have the chat open for you. Many of you submitted questions in advance, and we've got those circled and plan to get into a lot of them. But as we go through the presentation, please feel free to add anything to the chat. I do want to make a note that, one, I'm not a medical provider, and I cannot give direct medical advice. So if you have a very specific question about something you're experiencing, I want to direct you right back to your oncology team or your medical provider. Speaking of chat, I'm going to go back and make sure I introduce Kim Keeley, who is our Manager of Supportive Care and Integrative Oncology. And she is joining me. I usually cover the Q&A as the moderator. And given that I'm in the presenter chair today, I've asked Kim to step in. So Kim, do you want to say hello?
Sure. Hi, everybody. Thanks for joining us today. I am a social worker by background. I've had the privilege of working at UT for about 11 years now. Previously, I worked in our breast care clinic and our gynecology oncology clinics. So this is a topic that I've been able to learn a lot about, and I'm looking forward to Alex's presentation today. I will be responding to you as I can, and then at the end, I will go ahead and offer the questions to Alex so that she can answer those in the time we have allotted. Thanks so much.
Awesome. Thank you, Kim. So just one more note on me. I am a clinical social worker. I've been in oncology also now for many years. And for the last several years, I've been focusing on sex therapy. So I have a certification in that. I started that after working in oncology and talking to so many patients who were experiencing sexual side effects. I work really closely with our young adult group. And so that conversation came up in the realm of the only thing anyone told me was fertility. And we also know now that age really isn't a limiting factor when we're talking about sexuality and sexual intimacy. So today I hope to offer a lot of good information for you. And so here we go. When you guys registered, someone wrote in the chat that they appreciated that we were keeping it real with this topic. And I thought that was such a great comment. And so as we go through today, here are my objectives and how I hope to keep it real for you. So I hope to cover these topics fairly thoroughly. So we're going to get into some definitions of sexual health and sexual wellness. We are going to talk about common challenges experienced by women after cancer. We're going to look at the impact of those challenges on our emotions and our identity. And we're going to hopefully leave you with some ideas to increase intimacy. What I asked for you, one more thing, as I mentioned, if I don't know the answer, I'm also going to keep it real and tell you I don't know. And I will absolutely get back to you with anything I think would be helpful. I hope on your side you can help me keep it real by also identifying a takeaway that will impact you and your sexual wellness. So that's the whole goal, is that this becomes something you can integrate into your own life and well-being. I always like to start this presentation or a presentation on a topic like this with the slide about expectations. I think sometimes our biggest disappointments come not from the outcome, but from failing to meet the expectations we have in our head. And I think this graphic kind of illustrates what we thought we were doing on the left there, what our plan was. We have a direct line, we have a start and a finish, and we're going to go right back to where we were. And as many of you know who have experienced a cancer diagnosis, the reality looks much more like what you see on the right. So what I encourage is, rather than beginning with the end in mind, let's consider aiming for improvement. Let's look at small milestones. Let's look at our path and celebrate progress. Part of what we need to do to stay engaged is we have to reward ourselves. So we want to find all those small wins and also build in some rewards. A key component of this is psychological flexibility, which is why I think sex therapy as a practice is so important, to call out not just the physical things that are going on, but the emotional and the psychological, because we're really asking individuals who are navigating sexual dilemmas to be psychologically flexible, to be present, to be open to experiences, and to be capable of shifting to align with our values when you're looking at something that looks more like that scene on the right than you thought when we got started. I think a great way to also phrase this is, can we look at a brave new world? Can we shift from fear that often comes up when we're looking at expectations and excellence to curiosity? Can we explore this from the mindset of, what is this brave new world and what am I going to learn here? And wherever you are on that journey on the right, your sexual well-being is important. So that's absolutely key and paramount. Is if you're single, if you're committed, if you're thinking about dating, your sexual well-being is extremely important. So when we're talking about sexual wellness, we want to take a multidisciplinary care approach. So you see on here, I think this is the ideal state. I also want to add a little bit of a caveat that I know sometimes it's hard to find these people that specialize in this. But if you can start to find your team, I hope it looks like this. I hope it includes a sex therapist, integrative practitioners. When we are focused on sexual dilemmas stemming from a cancer diagnosis, your oncologist remains a big part of that discussion. Also, gynecologist or a medical provider stays in the mix here too. I want to go back to integrative practitioners. We are learning more and more about how acupuncture, how massage can impact some of the aspects of sexual dilemmas, relaxation, mindfulness practices, and so much more. I actually put sex therapy under integrative care, but we've separated them out here for just to call out each role. And then that key piece on the right, pelvic floor therapy. Pelvic floor health is so important. This is how we support ourselves with things ranging from constipation to urinary leakage. Those muscles in the pelvic floor, which are muscles, ligaments, that hammock that supports your bladder, your bowel, your uterus, all those areas of sexual functioning, we need a specialist to address those from a physical therapy standpoint. So I want to talk a little bit about the common difficulties or common side effects, I would say, that many women experience after a cancer diagnosis. So on the left, this is kind of what we're up against. From the time that you hear you have a diagnosis, we have treatment that is going to impact sexual functioning in some way. We can look at a variety of studies and they'll say anywhere from 5% to 100% of women will experience a sexual dilemma during and after cancer. And we're going to talk a bit about sexual functioning and sexual wellness as a whole, but this includes not just those physical changes you see in the column that is second on the left, but it includes our anxiety, pain, fatigue, relational concerns that can come up too. And during treatment, I think sexual concerns are often not addressed by our providers because they're focusing on those life-saving aspects of your treatment, that we're really looking at a life or death, and how we put that paramount comes from your oncologist, right? But sexual well-being is quality of life. So before, during, and after treatment, sexual wellness allows us to regain a sense of control. For many women, we'll use the word normalcy, which is a word I don't really love, but it's a return to self. That's one aspect that many women want, is to get back to their sexual identity. And so how do we do that? The majority of the referrals I get tend to fall in that right-hand column. I get a lot of referrals, probably the number one, and I think this is true across any certified sex therapist, is desire discrepancies. So someone is referred for a lack of desire. But it's always so much more than that, right? Often with a lack of desire comes those mental health challenges too, that there's a lot of depression, there's a lot of anxiety related to a lack of something that gave us life, right? I think libido has a root of the word of life-giving. And so it really is a key component. And then in sex therapy, we want to look at desire. We want to reimagine it. We want to talk about our desire to feel desired, our desire to be touched, our desire to be connected to a partner. So one of the first things we do in a sex therapy session is a pain assessment. And this comes from the roots of Jordan Rullo, and she's a fantastic psychologist. But in our first session, or early on, we want to talk about dyspareunia, which is painful sex, right? We want to describe that pain, which becomes so important. And you'll see on the next slide why that pain description really drives a lot of how we treat or how we approach a sexual dilemma. We want to know about the circumstances that an individual is experiencing the pain. Under what circumstances do you feel it? Under what circumstances do you not feel the pain? When did the pain begin, right? Is there pain with initial penetration? Is there pain with deeper penetration? These get to be pretty specific questions. So one of the biggest components of a sex therapy session is also a foundation of safety and trust. We're going to talk about, is there a history of difficulty inserting tampons? For some women who are in menopause, they may not have thought about that, but it's an important component to understanding an individual's relationship with pain. We want to talk about when you think about sex, what's the first thing that goes through your mind? If it's pain, that's significant. The two questions that are also really critical, going back to our multidisciplinary slide, is have you been assessed by a medical provider? Have you been assessed by a physical therapist? So we've done our pain assessment. Also in a sex therapy session, we're going to talk about history of trauma, difficulty with pregnancies. So we really need to know a fuller picture going into this. But so once we get through that pain assessment, we have kind of these top three common diagnoses that come up for women who are experiencing pain during sex. The first one is genitourinary syndrome of menopause, GSM. This is experienced by 50% of women in menopause. So what happens with the decline in estrogen is your hormone that provides lubrication. It provides that plumpness to the skin. It provides elasticity, blood flow. So when women say, I'm not experiencing an orgasm to the point I was before, that's a key indicator that that area is not getting as much blood flow potentially as it was. Often women describe sex as like sandpaper, or I've even heard like shards of glass. So really important that we look at introducing a topical estrogen or an over-the-counter option. What often doesn't happen is we prescribe estrogen, but we may not tell someone that it takes about 3 months for the benefits of estrogen to be felt in that area. There's a lot of questions, we'll talk about that, about the safety of topical estrogen for hormone-driven cancers. But really the receptors in the vulva retain the estrogen there. So for the most part, we're finding, and research is supporting this, that can be safe. It is also a case-by-case basis. So when we have descriptions along those lines, one of the things we have to do is we have to hold off on penetration until we know more, right? And then we also have to challenge our ideas of sex. Our menu of what can be pleasurable increases greatly when we change the concept of what we thought we were doing and expand that menu. Vaginismus is the second one there in the middle. This is an involuntary muscle spasm, often described as cramping, burning, soreness, achiness. And you can imagine if those muscles are so tight that they would get achy if anything impacted that area, just like when we're working out and we've got a muscle that's extremely tight and it aches over time. Cancer surgery, radiation, hormones can all impact this muscle area, right, in the involuntary reaction. Women often describe this as feeling like sex feels like something's hitting a wall. There's like a block there. So one of the things we do, and again, all of these three, I ask that you have been assessed by a medical provider or a physical therapist, because when we talk about things like dilators, we want that to be initially introduced, at least, if not followed by a pelvic floor therapist. We also might look at, we're going to talk about breaking the conditioning cycle here in a minute, but we're going to talk about things like deep breathing, like yoga. We also need to differentiate relaxation exercises from just relax. I get that a lot, that women have been told, just relax. That's not what we're talking about in this scenario, and that doesn't honor pain, it doesn't honor our experience. And if there's trauma there, it definitely doesn't honor that. So we want to differentiate that these are relaxation exercises that are self-supportive and restorative. We're also going to look at some exposure protocols where we introduce exposure gently. So y'all have probably heard the term exposure therapy. There's concepts of this in sex therapy where avoiding isn't going to get us closer to the experiences we want. And it actually reinforces some of this conditioning. So we'll talk about that here on the next slide, as I said. And then the last one, vulvodynia. This one is kind of our really difficult diagnosis because it tends to be chronic. Generally, it's 3 to 6 months that women have experienced some kind of chronic pain that seems to be present while there's an absence of all the other visible findings, like nerve disorder or nerve damage, infection, inflammation. So this one can be sometimes it starts as GSM and moves into a chronic condition that would fall more under vulvodynia. And so while there is an absence of some of the key players, what we do see sometimes is a connection to vulvar cancer. We're also seeing some connection to HPV with vulvodynia. So some things to note. This often, though, is a bidirectional challenge too, because it's experienced by women who are also having depression. And so we don't quite know chicken or the egg. And the aspect is it's both. Both the chicken and the egg are here when it comes to depression and anxiety, increasing our odds of vulvodynia, and those with vulvodynia having an increased indication of anxiety and depression. We're going to talk a little bit about some positions if someone has vulvodynia where we can reach pleasure without pain. So lots of pain management. You're going to hear me say over and over again, we honor pain. So we take pain off the menu and reflect on the things that we can do that feel safe and pleasurable. For vulvodynia, some patients have often also found relief with pain treatment at the site. So even using like an ice pack. I've had some women use CBD, topical CBD, and have some pretty good outcomes for that in disrupting pain. And that, again, is something that we want to really do with some guidance too, because there are some complications when we numb areas as well. So it's important that we think about that from a topical standpoint. So let's talk about why avoiding pain makes this situation worse. This is our cognitive conditioning cycle. And this comes from a CBT study of women who have experienced pain, and I believe it was a breast cancer specific study. So what happens, and you can see as this cycle, the wheel there, there's an approach, right? There's an indication that sex could happen. That might be, penis might be toy. It might be, depending on your alarm system, just the idea. Maybe it's a longer kiss with your partner. Maybe it's a back massage, and all of a sudden, catastrophe starts, right? So what can happen when we've been avoiding pain over time is our alarm system, our nervous system in our body gets to be so sensitive that it's almost like if a leaf blows by the front door, the whole alarm system goes off, right? And so as you see in the cycle, the idea, the approach initiates catastrophizing. Then we have the fear of pain. Once the fear is there, we have the hypervigilance of everything's going to be pain, right? And we have that internal narrative of this is going to go just like it did before. And then we're going to have difficult, all of the parade happens of all the difficulties. And once we become hypervigilant and we're looking for everything that could feel, sound, smell like pain, our body responds by decreasing lubrication, and those pelvic floor muscles tense right up. Right? We hold stress in our body, and our body tells us that by tensing. And then if there is to the point of insertion, then we have endorsed pain. Friction happens, and that provokes vestibulodynia, which is more of that chronic vulvar pain, and we go round and round that circle. So if we lead with avoidance, we're not going to be able to find those sources of pleasure and safety. So what we do in a sex therapy session is we interrupt this cycle. We reconstruct those cognitive thoughts that are happening with the catastrophe. We put those out and we find other options and thoughts that could also be true. We look at behavioral techniques. So that includes desensitization, includes relaxation and guided imagery, mindfulness. We do a lot of psychoeducation about the anatomy and even just about our pain, our alarm system. As I mentioned, it's important to talk about the nervous system and how this is a mind-body reaction that's happening. And we want to talk about how we can influence different physical sensations. And then with our partner, and going back to our slide with the bicycle and all the ups and downs, we have to, with our partner, approach this from a different mindset. We need to get out of the goal-oriented mindset and move toward one of pleasure. So we've talked a lot about the physical side of sexual dilemmas, and now I want to shift us a little bit more into the psychological and emotional side of things. So when it comes to sexual health, this is the definition from the World Health Organization. And I really like this definition because it's a macro approach. And this becomes the formula for what we talk about in sex therapy. It means that sexual health is not just an absence of a disease. It means that we're including our body image, self-esteem, sexual functioning, reproductive health, emotional and physical satisfaction, mental well-being. We have to unpack it all. It also means that pleasurable and fulfilling sexual and intimate experiences aren't out of bounds if one of our previous diagnoses is there. So as we saw that the sexual dilemmas are comprehensive, that's because sexual wellness is comprehensive too. This is a lifelong journey. So you see in our Venn diagram there that our sex life, our sexuality lives in the middle. And honestly, this Venn diagram can get pulled in all kinds of ways to depending on what's going on in someone's world. So our sexual feelings, behaviors, attitudes, and knowledge are a product of all the events that occur in each stage of your life and how we respond to them. When it comes to the psychological, that can include things like economics, education, religion, race, culture, our family of origin, attachment, orientation, body image, acute and chronic depression, fertility, fear of recurrence, all of those things and more in that bubble. Biology, that includes our age, our health, exercise, diet, our ability, sleep, cancer falls into that realm. The relational circle there is our relationship quality, our emotional safety, communication styles, roles, beliefs, and so on and so on. So when we're focusing on sexual wellness, we're focusing on reconnecting to your sensuality and feeling positive and comfortable with that sexual self in the middle. This slide, I love to have this conversation in sessions. And if any of you are on who have been in a session with me, we have talked about accelerators and brakes often. And if any of you know Emily Nagoski, who is referenced in the corner there, please let her know I want to be friends with her. I think we would get along great. But this context has been a game changer for many of the patients that I've talked to. So when we're talking about our sexual response cycle to desire, we have to unpack this a little bit in terms of arousal not being an on-off switch. That can be really frustrating for many couples, that this is not just light on, light off. Your nervous system, as it has for many mechanisms in your body, has accelerators and brakes when it comes to your arousal. So on the left there, you see our accelerators. These are all the things that you can see here, touch, taste, imagine, that bring about desire. They activate arousal. Our brakes, on the other hand, are all the things you can see here, touch and taste, imagine, that stop arousal. Sometimes this has nothing to do with sex at all. It has more to do with some of the internal and external stressors that are going on. We all have, male, female, everyone has accelerators and brakes, and we have different sensitivities. One of the unique challenges of cancer is that it can change our accelerators and our brakes. So sometimes women will say, you know, what used to feel good doesn't anymore. Now what used to be an accelerator is a brake. This also depends on context, right? Whether a sensation is perceived as pleasurable or comfortable depends on the context that it's in. This is really helpful in a lot of ways. This is why we might love being kissed, but we don't want to be kissed in front of our mom. That's the kind of context that helps us when it comes to arousal and how we know to expand the context that is contributing to our accelerators. So in a sex therapy session, we're definitely going to have this conversation at some point in time. And it's really great to have in a couple session because we can start to understand oh, we're hitting your brake. Well, I thought that was an accelerator for me. So how can we approach this differently? We also have to hold the challenge that it's not just taking your foot off the brake. We also have to find the accelerators, right? Emily Nagoski also has another great exercise that we often do in a sex therapy session. And I think this is a really different and unique way to think about our desire, which is in an emotional floor plan. So Emily says that we have these 7 core emotional rooms. And her theory is that it's the emotional space we occupy that influences our ability to engage in intimate experiences. And a lot of folks come to therapy because they're stuck in a room that makes pleasure nearly impossible. So on the pleasure favorable rooms in our house, we have care, lust, play, and seeking. Pleasure averse rooms would be panic, fear, grief, and rage. And I think we can relate to this in looking at our own experiences that we can't feel lust when we're in panic. We can't play when we're in grief. So the goal of an exercise here is not to focus on making ourselves feel differently, but it's on gently walking the floor plan of the house, right? It's on recognizing that I can't just jump into lust, going back to our accelerators and brakes, but I can focus on moving to rooms that neighbor lust, right? And one of my favorite rooms is play. Relationship matters. So we're going to shift now the presentation more into how do we increase intimacy. And I think it's really important to look at, especially in long-term relationships, that there are kind of 3 main components that really are critical. The first one is intimacy. And I don't mean this in terms of sexual intimacy. I mean this in terms of friendship, psychological closeness, communication, conflict resolution, loyalty. There's a saying that a romantic relationship is a friendship plus nudity. You can take that if you like it or leave it. But I think we oversimplify this in saying that we have to keep the spark alive. And that's a really reduced version of the truth here. And so we want to expand that to say, so our second component is thrill. We have to date our partners. We have to create romance. We have to share appreciation. Make an effort to treat your partner like the unique and amazing person that you chose. The Gottmans, if you're familiar with the Gottmans and couple counseling, they have a great exercise called love maps. We have to develop really granular topography in our map to our person. We do this really well when we start a relationship, and over time, I think we kind of get into this default mode of, well, I know the map. But the thing is, going back to our sexual wellness being a lifelong journey, that map is changing all the time. We've got detours, we've got new roads, we've got side roads and by roads, and we want to get to know all of those things. And that opens the door to sensuality, which you see around you here, excuse me. This includes the entire spectrum of touch and eroticism, from holding hands to making passionate love and everything in between. So the sensuality is the sex positive context that allows desire to grow in response. Strategies. This is what folks, when we get into therapy sessions, this is what they want. Just give me a strategy, give me a prescription, give me the how-tos. It's not quite that easy, but it can be, going back to play, super, super fun. So let's talk about that. Strategies to increase intimacy. The first one that gets mixed responses when I say it, schedule. I have on here specifically schedule sensuality, not sex. Some folks like to schedule sex, and if that's what you guys agree to do, that's absolutely fantastic, and it's a great way to prioritize your connection with your partner. But I really open this up to say sensuality so that we go back to that context. Sometimes we have to go slow to make progress. So we want to schedule sensual time to be responsive to desire. Determine what helps you feel more desirable. Some of this we do on our own, and some of it we do with our partners if we're partnered. Determine what behaviors from your partner can help you feel more desirable. How do you want to be touched after the changes that your body has been through? How would you like your partner to initiate sex? What encouragement do you need from your partner to feel more desirable? We talked about our expectations, but we have this expectation around normal sex, and we want to also expect that that's going to be different now, right? And what we avoid, as we saw in our condition cycle, controls us. So rather than avoid, let's accept a new sexual menu. This may include orgasms take longer. We talked about that. That can be a part of a physical response. We might consider introducing stimulating toys. We want to acknowledge that foreplay could be extended. Again, going back to play. Strategies for coping apply to our relationship just like they apply to our own bodies. So it's not just our partners, it's what are we doing for ourselves and with ourselves. Talking to each other is the best coping skill that supports creative, pleasurable, and supportive sexual activity. And again, play. Play means it can be spontaneous. It doesn't have the outcome in mind. We're doing it for the sake of how great it feels, and we're rewarding ourselves along the way. So we talked about scheduling sensuality. So let's kind of get into a exposure protocol that can be really helpful for some individuals, especially when you are challenged with what's really performance anxiety. We get in our head and we start to play out all the ways this will go, and then we are not present for our own pleasurable experience. So there is a great exercise that helps dose this out a little bit. So sensate focus is a structural, non-demanding touch technique that helps us reduce that sense of spectating, that I'm watching my own experience while it's happening. It also removes pressure, it improves communication, and enhances intimacy. This is not massage, so I'm going to tell you that up front. And we mentioned, I think at one point, that particularly a lot of women I see in sex therapy come in because they're doing this for their partner. Well, when it comes to sensate focus, this has to be for you. This touch has to be for you. Because if we engage in things that we're doing for our partner, we're repeating these negative patterns that contribute to some of the dilemmas that we're experiencing. So we go through this touch experience and stay in our touch experience for ourselves, not our partner. We focus on sensation, and we break that into three things: temperature, texture, and pressure. So the only thing that you're doing in this experience of both giving and receiving touch is focusing on temperature, texture, and pressure. It allows us to refocus. It allows us to bring in that non-judgmental standpoint of, if something doesn't feel good, move somewhere else. But again, this isn't about feeling good. It's about feeling. There's no demand, there's no expectations. Nothing should feel a certain way in this exercise. The ask is, can I just be present? We start this in phases. So we start with a non-genital touching. We invite partners to do this that clothed to their comfort level, a minimum of 1 time a week, and ideally every 2 to 3 days. So the ask is one of quality and not quantity. So in this experience, this can be 5 minutes of you providing touch to your partner. And again, grounding yourself in texture, temperature, and pressure. And then receiving touch from your partner and only focusing on those 3 things. We gradually build up. So you see there that we build to whole body touching, sensory arousal, mutual pleasure, and eventually can build towards sexual intercourse. So we get creative, we start with pleasure, and we allow for arousal. Man, I've got all the pleasures and arousals stuck. A couple of scripts that can be helpful for folks. We did get some great questions about dating, and some of these scripts can be really helpful when a relationship is in the earlier phases. Tell me something about my personality that initially attracted you to me. Keep doing this because it helps me feel safe and loved. Until I start feeling better, could we try this? I'd like to see if it could be a good experience for us. I'm comfortable with yada, 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 and I'm not ready for this. But when I am, I'll tell you. One thing that I have learned that we don't talk enough about is the difference between moisturizers and lubricants. And so we mentioned that, especially for GSM, we want to potentially look at, and I think for all women, all health, let's look at this as an overall vaginal health. We need to incorporate both moisturizers and lubricants. So moisturizers we are using for maintenance. So as we talked about, all of your skin gets dry, and especially if you've been through radiation or different types of treatment, that's true for the vulva area too. So we need to add in moisturizers for maintenance. They mimic vaginal secretion of pH. There are gels that work to hydrate. And what we're doing is we're bringing in hydration and moisture. There are tons of brands out there, and I really encourage folks to try a few. The common brands are Refresh, Replens, Reverie. Those names might sound familiar. They're all available over the counter. Amazon has a great selection of them. But just try which ones you like. Some are suppositories and some are topicals, so that may drive which one you like. And of course, we want to continue to use a lubricant during intercourse. And what lubricant depends on what is particularly helpful for you. So silicone lubricants increase longevity. Glycerin can increase yeast and be complicating for individuals who have a history of yeast infection, so just something to note. And some can reduce the effectiveness of latex condoms. If you do not want any of the initial chemicals, you can always take a natural approach and look at things like olive oil, coconut oil, that help increase that vaginal um, uh, lubrication. But we do want to, again, just note that sometimes the natural routes can induce some infection as well. So use caution, but also sample these and find out what you like. Suggestions around body image changes. So there's a direct relationship between a woman's view of her body and her relationship and satisfaction with sex. Direct correlation. And so we want to acknowledge that there's a mindfulness and body component to sex therapy that we want to support. And tuning in is always more effective than tuning out when it comes to cultivating really a positive relationship with our bodies, but even more so a sex positive relationship with our bodies. So mindfulness really means how we pay attention matters. The key components of a mindfulness practice are observing, noticing our internal experience in the present moment with non-judgment, right? Not categorizing an internal experience as either good or bad. Really leading with curiosity and what you're feeling instead of what you should be feeling. And practicing this really allows us to experience the sensations of sex. We can be present for them. When you're in the mood, when arousal starts, and when sex even becomes a green light, going back to our dual control. So when we pay attention, we see that there's more there, right? We also want to rebuild trust with our body, and this can be a ongoing process and a lifelong process for all of us. Cancer happened to you and your body. I think it is really hard when we sometimes end up with the perspective that our body turned against us. But I think it can be helpful to shift that to recognize that your body didn't ask for cancer. It didn't do anything to you. It also was given the cancer card. Our body innately strives to heal. So going back to looking at progress, brag about the parts of your body that are healing. Trust that your body is there for you, which again is so hard when trust has been fractured in a lot of ways, which also means you have to be there for it, right? You have to show up on your side of the things to support your body's wellness. It's a two-way street. Tend to your body when you're stressed, breathe, and recognize that sometimes we go slow to make progress. This is lifelong. It's a practice, not a perfect, and we lead with compassionate self-talk. Your self-worth is not based on how you look. That's related to your self-esteem, right? So we separate those things out too and spend a lot of time talking about that. Another aspect of a sexual dilemma that we don't talk about enough, I think, is grief. So that was on our early slides of some of the side effects that come up from cancer and its treatment. But we unpack this in sex therapy and for our sexual wellness, especially when it comes to disenfranchised grief. Disenfranchised grief is a natural response following a loss that's not widely accepted by society. This may include loss of one's precancer body, loss of the sense of safety that health provided at one point before a catastrophe or the cancer diagnosis, loss of financial stability, potentially with the cost of cancer, loss of one's daily routine to treatment, loss of the expectations one had around fertility, relationship changes, so on and so on. And so what you see in this graphic by Lois Tonkin is, the idea that some people say grief gets better over time, and that's that top row. Really what happens with our diligence is that we grow a healthy life around our grief. It doesn't get smaller. We introduce healthier and well-being around it. We introduce connections and relationships. Of course, one difficult aspect of cancer is that a diagnosis doesn't grant us from a passive experiencing the death of those around us. And if you get connected to cancer communities, that can be a really difficult part of that is you join a group where that may be more prevalent. And it becomes really complicated when we have a life-altering diagnosis. So maximizing our sexual well-being would be extremely difficult if we haven't acknowledged for grief. If we haven't acknowledged grief and we haven't allowed for the grief experiences related to those losses. So going back to our emotional floor plan where we can't play when we're in grief, grief demands that we accept things will be different while also making space for the awareness that losses and grief will be a part of us. Grief will never be something to get over. We can move through it. And while we don't have to make meaning, we can choose meaningful experiences through this process. We can change our outlook based on our values and potentially grow personally and spiritually as part of that. So I want to also include a couple of recommendations. So things that you guys can find on your own, start maybe potentially to put these on your bedside, let your partner know I've got some to be read piles going on here. So looking at these books, of course, I mentioned Emily Nagoski. I'm a huge fan of hers and how she breaks this down. But Lois Brato has a fantastic book there called Better Sex Through Mindfulness that I think is so helpful. Ian Kerner has some great content, and all of these folks cannot recommend Lori Mintz's book more also for claiming the fact that equality matters in a sexual relationship, especially for women. Apps and website recommendations. There are so many things out there now that you can have at your fingertips and at the ready to introduce more context for you to find responsive desire. There's a great app called Spicer. There's the Gottman card deck, and these cards go anywhere from kind of your general table topics to spicier options as well. So it's some fun things you can do with your partner. A new app that's really cool is called What We Should Try It. And so it's a fun questionnaire that really just starts to get the drive going, I think, a little bit. Mojo Upgrade, and then Quinn. There's some really interesting data around women's response to audio versus visual erotica, and this book really supports that. And so a lot of women find that to be more pro-positive sex when it's audio, as opposed to some of the challenges that we see in different types of erotica. Great list of resources here that have helped inform this. And then I think we're going to shift into our questions, right, Kim?
I think we are.
All
You
right.
told us to have one takeaway. I'm at 9. So thank you for that.
Awesome.
We had some pre-submitted questions, so we're going to start with those and then hopefully get around to the 3 that have come in through the chat. So the first one was many people mentioned Mona Lisa therapy. Can you tell us a little bit about that?
Yes, yes. Mona Lisa therapy is a non-invasive laser treatment. It has really been geared toward vaginal atrophy, so treating pain, treating dryness. Really great results from a lot of the women that I've talked to that have done this. I think it can be really helpful to increase moisture, and then hopefully we add in the layer of increasing desire later. So that's one piece that the laser treatment doesn't do. So we always kind of say it's going to help with these things, but remember that our sexual menu is much wider than that. So we want to start there and then grow it. One of the challenges with Mona Lisa is that it's not covered by insurances, or I haven't seen that yet. If you have, please let us know, but I have not seen that piece yet. So finances can be a bit of a barrier to folks accessing Mona Lisa. I will put in just a couple new treatments that are starting to show a lot of benefit. One is Addyi, which is an FDA-approved non-hormone pill. We will not, in women's sexual health, have Viagra. We just have a different set of chemicals that we're working with. But Addyi has been really offering some interesting, effective, safe improvements for women after cancer. So there have been more research with that pill. It is for women both pre and post-menopausal. So that's important to note too. And this pill helps increase desire. So while it's not treating like the Mona Lisa, it's not directly treating vaginal atrophy, it is starting to help increase desire and has been shown to do so very safely, especially for women after treatment. So one thing with Addyi is if there is pain on board, we still need to address the pain. So as I said, we're not going to have a one-stop pill, but we have multiple and increasing options in the pipeline. Another is Velesi, which is an injectable that's fairly new to the market. This injectable that is meant to be used prior to sex, so about a 45-minute window to introduce this injection. It is for women women who have already been through menopause. So something important to note there that if it may or may not be an option for you to take back to your doctor. But my one asterisk on Velesi is that there have not been studies in cancer. So we have seen that there are some side effects related to cardiac issues, which can already be a side effect of cancer treatment. So again, just things that you might write down and talk to your medical teams about, but we are opening more options.
I'm going to add that. I know you said it at the beginning, but we're going to say it here too. Anything we are providing you information about, we encourage you to write it down, look it up, bring it to your doctor. The My Chart function is really good for this. Send that message to your doctor and say, at my next visit, I want to discuss, and then tell them what you have looked into or what you'd like to consider. So we have another question about safety. Sex during chemo. What do we know about that?
Uh, it's generally safe, is what we know. I will always point you back to talk to your oncologist about your particular chemo because there are some guidelines for some of our really intense treatments. But generally, what we recommend is refrain from intercourse 48 to 72 hours after chemo. But after that window, generally pretty safe. Highly recommend the use of condoms for your partner as well. But the main thing is if you feel up to it, right? That's the biggest part of our whole message is let's support how you feel when you feel that way. So if you feel up to it, main things that can really impact that are fatigue and possible risk infection with platelets and things like that. So if you already have an infection or mouth sores, there might be a guideline to maybe wait a little bit longer than that initial window.
Okay. This, I believe, was addressed, but can you again look at the topic of what is the safety or recommendation of vaginal estrogen? Because the estrogen word can be very scary during treatment.
Yep. So an initial, recommendation, if we were to have a warning label on it, is this is case by case. So have these important conversations with your provider. We are seeing that this is much safer than initially thought for individuals with a hormone receptor. The diagnoses where I think there is more caution is still breast and uterine cancers, where hormones are hugely impacted. So those can be more iffy. But for the most part, cervical, vulvar, and beyond, topical estrogen is showing to be effective and safe.
Okay. You talked a little bit about communication. How do we bring a male partner into this discussion?
So I think the biggest piece is centering around safety and pleasure, right? Having the safety on board to have these really intimate, difficult discussions. Noting that neither of you are to blame. If you're experiencing sexual dilemmas in your relationship and this is new for you, voicing that it's not you, it's not him. This is a dilemma that's addressed by a shared goal, right? If you're newer to dating and starting to introduce one that you've had cancer, that can be a huge topic to share with a new partner. And that potentially you are experiencing some sexual dilemmas. One of the ways to lead, and that strategy slide included this, is start with what helps. Start with what your partner can do to support you as you're navigating some of this.
Okay. A A couple that came in a little bit later, I am looking at is what is the difference between a couples counselor or a sex therapist, and who should we go see?
Mhm. So, a sex therapist is certified mental health provider who has gone through both training and supervision in sex therapy. So it's really important to note that if you are wanting to start your couples approach focused on sexual dilemmas, look for CST is the credentials that you would find. The ASECT, sorry, I blanked on the accrediting body. ASECT, AASECT, has a list of approved sex therapists on their website. So you can go there and scan for that. I think there's so much crossover, right? A lot of individuals who offer couples counseling maybe got into the sex therapy certification after working with couples. Some sex therapists add in the couples counseling, but both will cover some of these main tenets. But I think a couples counseling approach may really focus more on conflict resolution, communication, shared visions, those kind of things that are also really important in sex therapy. So it would not also be uncommon for someone who has been in a couples therapy for quite a while to get a referral to work with a sex therapist for a handful of sessions and then go back to their couples therapist, right? So it is a unique combination of skills, but I would highly recommend if you're interested, look at the list and potentially call one or two and have some conversations about what you need from therapy and if they can offer that.
Okay. A couple of others I think are just topics that you covered, so I'm not going to ask you to repeat those, but I want to remind everyone that you are going to get the slide deck, correct, in addition to the recording in
That's
your
right.
email. So we know that there were lots of good resources at the end. We encourage you to look those up and use those slides to kind of do a little more digging into this topic when you can. Any final thoughts from our group in the chat? Does anyone have anything that they want Alex to address for us?
There was a question about Uberlube in the chat.
Hmm.
What do I know about Uberlube is it's a really great company and a great product. The marketing around Uberlube is kind of funny too. So if you want to just take a minute and Google something, they've really marketed this as a one-stop shop lubricant. So it's kind of funny that they are marketing it to marathoners who need chafing lubricant to sexual intercourse. And I think they're doing that more for Americans than anybody else because we like efficiency over here. But it is a safe product. It is a high-end product. They also are very generous with samples, so it can be a little more
Hmm.
expensive than some of the over-the-counter lubricants, but highly recommend checking it out for sure.
Lots of thank yous in the chat. Lots of appreciation for covering this topic. Again, um, providers vary in their level of addressing this, but you are in charge of your health too. And so what matters to you is something that you need to bring up and that your providers should find a way to address with you. And we would love to help you advocate for that.
I will just highlight one more question that came through, and I'm not sure I gave it enough attention on the body image slide. Exercise. So there was a question about, what is our overall route to vaginal health, especially after something like a hysterectomy? What do I need to be doing for my body? Again, lubricants and moisturizers are really, really important. Check on estrogen. Ask about pelvic floor therapy, but highly recommend exercise and routine exercise. When we can see what our body can do and go back to those small wins and progress and feel the strength that we have in our body and the different ways that it moves, it again can help us open that door to a sexual menu that is possible. So highly recommend that for both mind body wellness.
Sounds good. We thank you for sharing your time with us today. We thank you for your great participation. Anything else from your end, Alex?
No, I just again appreciate you spending this hour with us, and hopefully it was helpful. And my contact information is also on the slide deck if I can be a resource for anyone too.
Thank you all.
Thank you.
Bye-bye.